Alright, so I've gathered my supplies. I'm going to wash my hands. I'm going to close your privacy curtain. Hi, my name is Kelsey. I'm here to do a head-to-toe assessment. Can you please state your name and date of birth for me?
Alyssa Calderwood, June 15th, 1991.
Perfect. Alright, like I said, we're going to do a head-to-toe, so I'm just going to start your head and work your way down. To get started first, I'm going to do your vitals. Can I borrow your arm to do your blood pressure? Our pulse oximeter, and put this under your tongue, get your temperature, and then I'm going to go ahead and take your pulse. Alright, your blood pressure is 108/67, your heart rate is 80, your respiratory rate was 18 breaths per minute, your temperature is 98.6 degrees, and your pulse, or your oxygen saturation is 99%. Take this off. Are you in any pain right now, Alyssa?
No.
Okay. Can you please tell me where we're at right now?
At the hospital.
Okay, and what's today's date?
It's December 6, 2014.
Okay, the patient is alert and oriented to person, place, and time. Her speech is clear and understandable. She seems to have good personal hygiene and is in good health. She is in a calm mood, and her facial expressions and affect reflect that. Alyssa, can you smile for me and stick out your tongue? Okay, perfect. Patient's facial expressions, their facial features are symmetric and proportionate size to her head. I'm going to take a look at your eyes. Can you just look at my nose for me? Okay. Patient's pupils are equal bilaterally and approximately 4 millimeters in diameter. The next thing I'm going to do is take a look in your mouth. Can you open up and say ah? Okay. Patient's mucosa of her mouth and throat are pink. Her tonsils are out. Her tongue is pink and smooth. There are no lumps, lesions, masses, no signs of cyanosis or jaundice. Her tonsils are out. That's what I was going to say. Next thing I'm going to do is I'm going to move on down to your neck. Skin on the neck looks good. No lumps or lesions. I'm going to palpate your carotid arteries. Carotid arteries are 2+ bilaterally. Next I'm going to move on down to your arms. I'm going to take a look at the skin on your arms. Skin on the arms and hands show no lumps or lesions, no sign of cyanosis, no clubbing in the nails. Her capillary refill is 2+ is less than 2 seconds bilaterally. Can you squeeze my fingers? Okay, that's good. Her grip strength is equal bilaterally. I'm going to feel your radial pulses. Her radial pulses are 2 plus bilaterally. Next, we're going to do range of motion. Can you just sit up for me a little bit? Give yourself a little bit more room. Can you just lift your hands up above your head from the front? Okay, and then can you go as far back as you can? That's good. And then can you bring them up above your head, palms together? Perfect. Next thing I'm going to do is I'm going to move down to your chest and back. I'm going to start with your back. Skin on the back shows no lumps or lesions. It's warm to the touch. Alyssa, I'm going to put my hand on your back in a few different places, and I just need you to repeat the phrase 99 for me, okay?
Okay.
Go ahead.
99.
And again.
99.
And again.
99.
One more time.
99.
Tactile fremitus is bilateral, or is equal bilaterally. Next thing I'm going to do is I'm going to place my hands right here, and I just want you to take a deep breath. Chest expansion is symmetric. Next thing I'm going to do is I'm going to percuss your back. Okay. Percussion is resonant throughout the lung fields. All right, you can sit back for me. I'm going to take a look at your chest. There are no signs of lumps or lesions, no cyanosis, no obvious pulsations on the chest. I'm going to go ahead and palpate for pulsations. I'm going to palpate the apical impulse. There are no pulsations present. The apical impulse is located at the 5th intercostal space mid-clavicular line. Next thing I'm going to do is I'm just going to listen to your, I'm going to percuss your chest. And then I'm going to listen to your lungs and your heart. Percussion shows resonance over the lung fields, dullness over the heart, and the liver and tympany over the stomach. Now I'm going to listen to your lungs. So I'm going to, again, need a series of deep breaths from you.
Okay.
Okay, deep breath. 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 Okay, can I have you sit up for me? I forgot to listen to your lungs on the back. Go ahead, deep breath. Deep breath. Deep breath. And again. And again. And again. And again. And last one. Okay, you can go ahead and sit back. Both anterior and posteriorly, the breath sounds are clear and vesicular throughout. Now I'm going to listen to your heart. I'm going to listen at the 2nd intercostal space on the right sternal border for the aortic valve. And then 2nd intercostal space left sternal border for the pulmonic valve. And then down to the 3rd intercostal space for Erb's point. And then down to the 4th intercostal space on the right sternal border for the tricuspid valve. And then I'm going to listen to the 5th intercostal space mid-clavicular line for the mitral valve. And I'm going to compare that to the apical, or to the radial pulse. Okay. There's no pulse deficit noted. The S1 and S2 are heard clearly. S3 and S4 are not present, and there are no signs of murmurs. I'm going to move on down to your abdomen. Can you just slide down for me and lay flat? Okay, so I'm going to inspect the abdomen. Abdomen is flat. It doesn't appear distended. There are 3 small scars on the stomach. There are no striae. Alyssa, did you have an abdominal surgery?
Yes, I had a splenectomy.
Okay, and there were no complications from that surgery?
No.
Okay, good. The next thing I'm going to do is I'm going to listen to your abdomen. I'm going to listen to your abdominal aorta. Okay. Valve sounds are normal throughout. There are no signs of bruit at the abdominal aorta. Next thing I'm going to do is I'm going to percuss your abdomen. Abdomen has tympany throughout, and then I'm going to palpate your abdomen. Let me know if you have any tenderness, okay? And then I'm going to palpate the distended bladder. Okay. Patient reports no tenderness. The abdomen is firm, but not distended. There are no signs of lumps or lesions, no masses noted. You can go ahead and set up for me. Are you having any trouble urinating?
No.
Okay. And what color is your urine normally?
Clear.
Okay. And is it normally clear or cloudy?
It's clear.
Okay. Next thing I'm going to do is move down to your legs. So I'm going to take a look at your legs. Okay. There are no lumps or lesions noted on the legs. No signs of cyanosis, no edema. Capillary refill on both feet are equal bilaterally. Next thing I'm going to have you do is just press against my hand like you're pushing on the gas pedal. Okay? And then the other side. Alright, perfect. Motor function is equal bilaterally. We're going to check your range of motion. Can you just lift your leg up one at a time? High as it'll go? Perfect. And then other side. That's good. Can you bend your knees for me? Alright, perfect. Are you having any dizziness?
No.
You're not having any trouble standing or walking on your own?
No.
Okay, can you go ahead and stand up for me?
Yes.
Alright, can you put your feet shoulder width apart and close your eyes? Okay, good. Patient has good balance. Can you walk to the end of the room and back for me? Perfect, you can go ahead and have a seat. Patient's gait is steady. That's all I need from you. Do you need anything from me before I go?
No.
Okay. Here's your call light and your water. If you need anything, please just press your call light. I'm going to put your bed all the way down. I'm going to open your privacy curtain. I'm going to go wash my hands and record my findings. Time.